So listen, there are 500 cases of corona here in the U.S. Many states, the number has, quadrupled in a couple of days. What's happening?
You have 2 million hours? So first of all, you guys know this, but just so that people at home understand, at ABC News, we are getting literally briefed and updates by more often than an hour from the CDC, World Health Organization, top infectious disease specialists, epidemiologists, local people in hospitals, nurses, doctors, patients. It is literally around the clock. I've been doing this for 13 years. I've never seen anything like this in terms of a global public health emergency. Whoopi, to get to the number you mentioned, that has to be interpreted with a chunk of salt, not a grain, a chunk. To say 500, what's really important is how many people are being tested. And remember that even the people being tested represent the tip of the iceberg, because those are generally the more severe or the sicker patients or the people who have been known to have direct contact. We don't know what's hiding in plain sight. We don't know how many people have been exposed and have no symptoms, have mild symptoms, think it's something else, which it easily could be. By the way, there's a great saying in medicine: when you hear hooves outside the door, think horses and not zebras. Still, could it be the cold? Could it be the flu? Could it be allergies? Yes, yes, and yes. So to hang your hat on the given number count of the day, which we know will go up as we are able to test more people, understand that what is generating so much concern on the part of doctors and scientists and public health officials and governments, companies all over the world is the unknown. And in medicine and science, it is so important now more than ever to be comfortable saying, I don't know. Because there is more about this. This virus is less than 3 months old. There is a lot more that we don't know than we do know. And sometimes that's as important, by the way.
Well, you mentioned tests. We don't have enough test kits.
Well,
what's going to happen there? We need.
First of all, the testing process has been fraught with missteps from the beginning. If you want to remember the timeline here, again, about 10 weeks or so, give or take. China first identified this in December. We're less than 3 months in, but we need to scale up and scale up quickly if we are going to understand how prevalent or common this is in this country.
But where are these test kits going to come from?
Well, first of all, a lot of the components of these test kits contain ingredients and parts that come from China. So if there's a supply chain disruption, we may start to see that. But on the part of private industry, medical centers, academic medical centers, the CDC, we are trying to scale up, and I mean scale up to the point where we can test hundreds of thousands and millions of people.
What if you don't feel well and you live in New York?
Where should you go?
What do you do?
Because I have a cold right now.
Exactly.
And I promise I think I'm okay.
Sure?
I think I'm okay.
Well,
but how do I know, Dr. Jen? Should I be tested?
So here's the important thing right now.
Now she tells us she has a cold.
Into the arm.
Oh, into the...
Sorry. Sorry. I got you. I got you.
Deborah.
I got you.
Deborah. Don't touch it.
All right. So this is really important. First of all, medicine is not robotic. It's not cookie cutter. It's not phone in. All right. Ultimately, patients need to be evaluated by a real humanoid. Okay. But there are some general things that I think will help people. Number one, as I said, common things occur commonly. So if you're in a part of the country where you're not seeing massive uptick in coronavirus documented cases, you are still more likely to have the common cold, which, by the way, could be another strain of coronavirus that we've all been exposed to. Common cold. Okay. Coronaviruses were first documented in 1960s. We've all likely had a strain.
And
it's just that this strain is new. Exactly.
19.
All right. But, and I'm going to correct you a little, Dr. Joy, that you don't have to have a fever.
I went to Trump University. Go ahead.